everybody. Welcome to this episode of Geeky Clinicians Podcast. All right, so as always, I am your chief geek here, Dr. Deborah Dantzler, and we are so excited to have Libby Murdoch, an EMDR guru and expert with us today. So we're going to be talking all things EMDR and brain science and get geeked up about that. And so, but before we jump in and have this conversation with Libby, I want the other geeky clinicians to introduce themselves, and then I'll read Libby's bio.
Hi, I'm Jacinta. I am lead therapist here and lead geek.
Hello, everyone. My name is Mona Taki. I am the Geeky Clinical Yogi, and I am a first-year postmaster's resident.
Welcome. All right, so today, as I said, we have the honor and privilege of having Libby Murdoch. She's the founder, and she's a licensed professional clinical counselor, certified clinical trauma professional. So Libby leads basic EMDR training for Thrive Training and publications.
That one's outdated, so we might want to pause.
Yep,
pause. So I'm not sure where that.
Hello, everybody. Welcome to Geeky Clinicians Podcast. And today we have the honor and privilege of having Libby Murdoch, an EMDR guru, with us today. But as always, before we jump into that conversation, I am your chief geek here, Dr. Deborah Dantzler with Geeky Clinicians. And I'll let the other geeky clinicians introduce themselves, and then I will read Libby's bio.
Hi, I'm Jacinta. I am a lead clinician and lead geek here.
Hello, everyone. My name is Mona Taki. I am the Geeky Clinical Yogi, a first-year postmaster's resident.
All right. So as I said, we're so excited to have Libby with us today. And so Libby Murdoch is a licensed professional clinical counselor and certified clinical trauma professional who facilitates basic EMDR training for clinicians on a monthly basis. She is the developer of resilience-focused EMDR and psychological CPR. Can't wait to learn more about that.
Right.
Libby has presented at various conferences across the United States and internationally, specializing in neuroscience topics such as resilience, relationships, self-care, trauma, and addictions. She utilizes techniques based on brain science in treatment, including EMDR, and is passionate about making neuroscience accessible to everyone. Welcome, Libby.
Thank you so much for having me, all of the geeky clinicians. I'm excited to be here. And as I hear you kind of read the last line of the bio, it just reminds me like what a lot of my friends and colleagues say about me is that I make brain science easy to understand and apply. So I am really looking forward to having a conversation today about EMDR, which is a skill set that not only has changed the game for me personally, but has really changed my clinical practice. So I can't wait to share with you all today.
Yes, and that neuroscience and accessibility, I can give a testimony about Libby personally because I just attended her presentation in Virginia Beach at the Clinicians Connection, and it was amazing. I had so many pages of notes, but she'll get into all of that. So Libby, here at Geeky Clinicians, which is a community for clinicians by clinicians, we always like to start with your origin story.
Oh, I love
What is your clinical origin story? How did you get interested in this field? And how did you get from where you started to being the neuroscience geeky guru that we have today?
Yes, and I am truly a geek. So like when you ask me this question, I'm already getting chills because I'm just like so excited. Because like the longer I'm in this work, the less I believe in coincidence. And so I really feel like the path that I was on, like I was placed there, if that makes sense. And so I can remember being in graduate school, so I was still a baby therapist, and my mom bought me a book for Christmas, Brain on Fire. And it's actually a New York Times bestseller. It's been turned into a movie. And I won't spoil it for you, but this book, and you know how it is in graduate school, right? We don't read, we skim. But I read this entire book in 24 hours, and it really left an impression on me. And the impression that it left was, oh my God, I am going to be working with people's brains, and I do not understand the brain. And I also don't understand how the interventions they're teaching me in graduate school are actually going to help the brain heal. So that was kind of like the origin of my mission. And so I remember going back to the leaders of my program, and I said, you need to connect me with a clinical supervisor who can help me learn everything I possibly can about the brain. And they were like, there's one person and one person only. Her name is Mary Vicario. And it's actually really cool because we just got back from the Trauma Research Foundation conference that was happening in Boston last week, which was just amazing. So now I get to travel with her and learn, and we also sometimes get to train together. But that was kind of like the beginning of my journey. And what's also really cool about that is my inspiration to become a trainer also kind of came from meeting my clinical supervisor. I can still remember seeing her train for the first time and how people were just hanging on every word. And that was me. And I was like, oh my God. It just occurred to me that, like, if I do the training in addition to doing counseling, I can kind of expand the impact that I'm able to make. And man, that, neurobiology and the brain science was just so impactful for me. And so I was like, I really want to be able to share this with other people. And so that kind of began my mission to learn everything I could about how our environments, relationships, and experiences impact our brains and our ability to function. But then also looking at what are interventions that I'm able to understand how those are working within the brain and the body in order to facilitate healing. And that led me to take the Traumatic Stress Certificate program that used to be offered through the Justice Resource Institute in Boston. I think Bessel van der Kolk headed that up at one point in time, and that was when I was taking the training. And so I remember hearing Bessel talk about EMDR therapy for the first time.
Oh,
And
wow.
he was initially a huge skeptic, right? He was like intrigued, but he's like, this isn't going to work, right? Like,
Yeah.
it is kind of unheard of, and it's kind of hard to wrap your brain around, right? Especially if you've been doing a lot of cognitive therapies, to kind of think that, oh, in like one session or even a few sessions, that someone could feel resolved about something that has been, plaguing them for years, if not decades, right? So
Yeah.
Bessel talked about his experience of going to EMDR training and getting partnered with someone who would not even share his trauma narrative. And so Bessel was like, well, now it's definitely not going to work. But
Uh-huh.
I'm sure you all can guess the end of that story. It worked. The,
Worked.
the client got better. And then
Mhm.
Bessel bought in hook, line, and sinker. And he started talking about it at all of his new frontiers of trauma treatment trainings, which is kind of the thing that really inspired me to go get trained in EMDR. And kind of the final thing that he said that was really impactful that day was, you know, using like talk therapy to treat trauma is kind of like taking someone's tonsils out through their nose. Like, it's possible, but why would you if there's maybe a more direct route to that? And so that's kind of what Bessel was saying, is that with bottom up techniques, EMDR, accelerated resolution therapy, brain spotting, parts work, right? These more brain and body based interventions that are able to work with not just the conscious parts of our brain, that they can actually be more effective in terms of resolving, the impacts of our trauma, of our environments, relationships, and experiences.
So I'm curious in terms of the timeline. Had he already completed writing The Body Keeps the Score when he had gone through that experience that you're talking about, or was the book something that came out after he'd been exposed to that? Because I
That's
don't know when it was published. I could go
Yeah,
look,
that's a
but I
great
don't know.
question. I do know that at the time I was taking the training,
Uh-huh.
The Body Keeps the Score had already been published, and that was a
Okay.
known work. So I'm not sure. My guess would be that he likely took EMDR training after writing Body Keeps the Score. I can't say for certain. But what I do know, especially because he was just there last week at the Trauma Research Foundation conference, is that a lot of what the research is saying is really just reaffirming the the theory essentially behind EMDR that we call adaptive information processing. And there's
Mhm.
really two key components to the theory behind EMDR. And
Okay.
the two things, first and foremost, EMDR believes no one's broken. We're all affected. And that's exactly how our
Mhm.
nervous system was designed to be affected by
Mhm.
our environments, relationships, and experiences. And it makes a lot of sense if you think about it, right? Because if I grow up in a rural farming community where there are no paved roads, right?
Mhm.
Versus if I grow up in New York City, well, I'm
Uh-huh.
going to need very different neural pathways in order to support my survival in those two very different environments. Same things with relationships, whether they're safe, responsive relationships that with people that consistently show up to meet our needs, or, maybe those types of relationships that are more neglectful or abusive, right? Where we have to have a different set of neural pathways in order to survive in an environment like that. And then, of course, the experiences too, right? Like the good and the bad, car accidents, graduation, birthdays, right? Like, getting married, even some things that are positive stressors, right?
Mhm.
Um, so this idea that if we have a challenge, if we have even a diagnosis, if you will, the reason that's there is because there's some sort of unresolved past environment, relationship, or experience. And so
Mhm.
the key to helping you heal is to really identify what are those past memories that we need to work on. And then the other piece of this, which is probably my favorite part of the whole thing, is that EMDR focuses on our brain and body's natural capacity for self-healing. I would love to hear, from you all, but my experience as a clinician, especially coming out of graduate school, is that I was told your job is to help your clients find the answers that they've always had inside of themselves, right? That's what counseling is really about. But then I felt like I ended up with tools that like kind of firmly put me in the driver's seat. Like, and I was forever working harder than a lot of my clients to get to our therapeutic goals. But what the cool thing is about EMDR is it really relies on each of our capacity for self-healing, right? Again, the adaptive information processing system, which is this idea that all of our brains and bodies will heal naturally when they can, right? But just like with a physical injury, like let's say you get a paper cut, most of the time when we get a paper cut, we don't bleed out, right? The blood clots, you get a scab. A few days later, you're like, oh, I didn't even remember I had that paper cut. But if you're like one of my dear friends who recently cut themselves with a saw while doing some work in their backyard, you probably need to go to the ER, right? Because she required some stitches and she also needed some antibiotics to make sure it didn't get infected. Same thing with the brain, right? For the most part, our brain can overcome challenging, stressful experiences. But if we have a lot of little stressful experiences or traumatic experiences over time, or one really big, overwhelming experience, it can kind of be like a washer that gets stuck in the middle of the wash cycle, right?
Mhm.
Like that natural healing isn't able to kind of complete. And so with
Yes.
EMDR,
Mhm.
we're essentially jump starting that wash cycle, right? So that that wash
Mhm.
cycle can come to completion and we can end up with clean clothes and a client who's not experiencing symptoms, whether that's things like PTSD, anxiety, and depression, which EMDR is
Mhm.
evidence-based to treat. But I'm also really finding EMDR is wonderful for things that don't even have a diagnosis, things I've worked on personally, like perfectionism, imposter syndrome, people pleasing, and insecure attachment, are things you
Yeah.
can address with EMDR.
I love that you gave that analogy. And I often, ask the question, can you bleed to death from too many paper cuts? Yes, because it's the repeated thing. And then I feel like I was talking to somebody or engaging in a conversation recently around addressing and working towards healing trauma. But what do we do when the trauma's still happening?
Mm,
What do we do when it's still actively going on? Our one of our areas here is narcissistic abuse recovery or antagonistic relational stress. And I want to talk a little bit more about that relationship because that's what you kind of that relationship and resilience you talked about in your presentation.
yeah,
And so, but the idea of what do we do with when it's still happening?
yeah. Well, so one of the things I like to kind of always honor is that all counseling has limitations. I don't care what tools, techniques you're using,
Mhm.
they're not going to be able to prevent someone from being impacted by an ongoing traumatic experience. Now, with that in mind, can it help the person be healthier or show up more adaptively, even in spite of that? Absolutely. And so I think this would be a great time to kind of bring up one of the concepts that I've seen show up a lot in my work, which is this idea that growth and healing is what we need to get to happy feelings. And so
Mhm.
a lot of times in my work, I'm trying to come at things from two angles. And so one of the things you heard me talk about at Clinician Connection is more of like the positive psychology angle, which involves teaching people that we are fully capable of creating good feelings and sensations inside of our nervous system, and that we can actually use that capacity to literally reprogram our baseline mood state. Right? Like, let's say that you're someone who is chronically depressed or someone who is chronically anxious.
Mhm.
The idea is if I can help you build these resources, and just as a few examples, things like imagining a peaceful place, right? Maybe there's a peaceful place in nature, and we're going to help you connect with
Uh-huh.
all of the sensory information of that peaceful place, and then notice what happens in your body. Or another one that we actually talked about at the conference was positive relational resources. So
Mhm.
remembering a moment where you felt really connected in relationship, and again, kind of taking yourself there, connecting with what you were seeing and hearing and smelling and all of those things, and then noticing what comes up in your body. And we know that if we can combine that with diaphragmatic breathing, also known as belly breathing, right, where we're inhaling and that air is going into our diaphragm and our exhale is longer than our inhale, and we're doing that not just reactively, which is coping.
Mhm.
Coping's not bad. We want people to cope, right?
Mhm.
But what a lot of people fail to realize is that if all we do in life is cope, respectfully, we're keeping ourselves stuck in survival mode, right? So we need
Yep.
a both and. We need a coping and regulation. And so
Yes.
I'll invite the people that I work with to twice a day for just 2 to 3 minutes. I want you to do your breathing, and I want you to intentionally bring up those positive emotions and sensations using the resources that we develop together. So, what that can do, which is growth, right? Literally developing new neural pathways for healthy, effective coping skills and regulation skills that, again, have the capacity to what we would say widen our window of tolerance or
Mhm.
increase our distress tolerance, right?
Mhm.
Because, again, we're designed to be affected.
Mhm.
But if we've had a lot of toxic stress or trauma, we don't have very much of a window, if you will, right? So we don't have very much of a tolerance for things. But if we can kind of use these tools, it can actually expand our window and give us more space so that, yes, the things affect us, but not in a way that derails us like it may have been in the past, maybe. And again,
Absolutely.
yeah,
Absolutely. And the fact that now it gives us that extra boost or extra capacity, as you would describe, to maybe be able to see the situation differently,
Yeah.
where maybe there can be an exit strategy or new coping strategies or to navigate things if we can't get out.
yep,
But the fact is, if we don't address it, the idea to say if the person's still in a traumatic situation, there's basically nothing you could do is not true. And
not
so I
true.
love that.
Not true.
Yes.
And
Yeah.
again, these are the more protective factors, right? The things that the client can do to protect and enhance their resilience or even maintain it in a stressful situation. But
Mhm.
the other side I want to point out as well, because the really cool thing about the healing, which is in EMDR, what we refer to as processing. So
Mhm.
anyone who's EMDR trained, this is what we would refer to as phases 3 through 6. And there is an intervention. So EMDR is 8 phases, and it has some distinct phases that are kind of like things you do on their own. But then there's an intervention inside of those 8 phases. And that's what we refer to as processing. And what we're doing when we're processing a specific memory is we're performing positive trauma resolution.
Mhm.
And so the best way that I can kind of describe this in metaphor is it's like uninstalling an outdated program on your iPhone, right? Like I'm sure you all can relate to that because I know how I am. Apple releases a new update and I'm like, not no, but heck no, right? Because they're going to screw with my phone. It's not going to work. But then when I resist that update, right, like my phone eventually stops working. And so that's what's happening for all of us because of our past environments, relationships, and experiences, we have these outdated programmings that are running inside of us, affecting our thoughts, our feelings, our behaviors, and how we're showing up in the world. Also, what we're willing to tolerate in relationship with other people, right? So if we can help our client, especially someone who's like a victim of this type of abuse, to work through those underlying environments, relationships, and experiences, and to earn more secure attachment. I have actually had the experience of a client getting to a point where they get so healthy, they're able to leave that abusive situation because they have now developed what we would call an internal locus of control and the ability to know my worth and value isn't dictated by this person and how they're treating me.
Yes, yes. So Mona, Jacinta, questions for Libby?
Yeah, I see that it's very like your website is brain-based EMDR. So is regular EMDR not brain-based?
So it is all very brain-based, Mona. That's kind of the cool thing about it. And really quickly, I can run through like just like how does EMDR work a little bit differently in the brain as opposed to something like talk therapy. And then I'd like to talk about maybe what sets our training apart from other basic trainings. Because the thing to know is that number one, you definitely want an EMDREA approved EMDR basic training, which ours is, and there are many out there to choose from. And EMDREA is the International Association of EMDR. They kind of set like the quality and the standards for EMDR education. But then each EMDR basic training is going to kind of have its own spin, right? So ours is really focused on neurobiology, and to the point that we want you to feel empowered leaving our training to be able to share that neurobiology with your clients, because we have heard and experienced that it can really help enhance a client's buy-in if you're able to give them the science, right? A lot of our clients are really logical, and it's kind of hard to argue with the science. And so that's kind of part of it. But so when we think about EMDR and the brain, I always like to do the hand brain. This is a creation of Dan Siegel, and it allows us to have kind of a working model for how the brain works. And so if you were to touch your forearm, that actually represents your spinal cord. And then if you touch the palm of your hand, that's your brain stem. So it's responsible for all the things you don't want to think about: your heart rate, your blood pressure, digestion. If you fold your thumb in over the palm of your hand, that's going to represent your limbic system. This is the seat of emotion and motivation. And together, the palm and the thumb, those are your survival centers, meaning these parts of your brain exist without your capacity to control them with your thoughts, right? They are there to keep you alive. So now if you fold your fingers down over your thumb, that's actually going to represent what we would call the cortex, or the logical thinking brain, right? This is the part of the brain that you have control of with your direct thoughts, okay? So traditional talk therapies are really going to engage this upstairs brain, right? The fingers that are covering the survival centers, okay? But what we have learned is that our past environments, relationships, and experiences, for example, our traumas, are going to get stuck here on the thumb, right? Which is a part of the survival center. And so what we know is that stuff happening here in the thumb and in the palm only takes 14 milliseconds. Okay, so this part of your brain can categorize and react to something within 14 milliseconds. This part of your brain up here, 400 to 500 milliseconds, right? So when we think about how do we help clients overcome traumatic experiences, we can't just use interventions that are going to engage the top fingers. We need interventions that are going to activate the thumb and actually help to flip the client back and forth between the thumb and the fingers that are covering the survival center, which is what EMDR does, right? When I go to process a target or a specific trauma memory with a client, I ask them questions about images and emotions and sensations, and that actually activates the neural network downstairs, which we know is required in order to harness our brain's power for neuroplasticity. I know that's a really fancy word. It basically just means that if we activate this neural network that contains the trauma, we can activate our brain's capacity to be plastic, right? So we can change a network in our brain that has already been affected by something like trauma. And by nature of the intervention, we're here, but then we're also having the client stop and kind of reflect on what's happening, which brings them here. And so what we would say is that before EMDR, you've got that trauma stuck on the here and now part of the brain, right? Where it's causing symptoms, things like sleep disturbances, nightmares, flashbacks, intrusive thoughts, or really just patterns of behavior that aren't serving the client. After EMDR, that memory has been moved off of the thumb and here up into the upstairs brain. And it's now what we would refer to as semantic memory, meaning that it's just a fact, right? So it's kind of hard to believe again. And I can only say it because I've seen it happen so much and because I've experienced it myself. But you can have a significant trauma that's occurred to someone. And after EMDR, you ask them to bring it up again, and they kind of do this. They just like shrug their shoulders and they're like, it happened. That sucked, but I just don't feel the same way about it that I did before.
Okay.
Leads to change.
Okay, that's awesome. I have a question because here at 3D Psychotherapy, our theoretical orientation is psychodynamic psychotherapy. So one of the granddaddies of talk therapy,
Yes,
right?
yes.
So that is our theoretical orientation. And I do think we use some of this, incorporate a lot of this awareness of body work. We do a little bit of parts work. We do this. Obviously, we're not well trained in EMDR yet, right? Yet. But how do you see these two orientations blending if we wanted to continue to blend them?
Yeah.
I have an idea in my head, but I want to hear what you have to say about possibly those two things coexisting.
Absolutely. And I think this is one of the beautiful things about EMDR as a theoretical approach. It may or may not surprise you to learn that EMDR actually pulls from most major psychological orientations, including things like psychodynamic therapy. So, no matter what interventions or modalities you're coming into the training with, there is a space for those in the context of EMDR, which is what I love about it. It provides structure, but it's also really flexible and intended to be tailored to the client and provides this space for us to be more integrative, right? So like, let's say that you're DBT trained, right? Like that, there's a place for that in our phase 2, which is what we call preparation, where we're really preparing the client and making sure they have, interventions or tools that are working for them to regulate their nervous system. And so you could certainly teach DBT skills there, right? In terms of psychodynamic theory, I think that could also help with the case conceptualization, or what we refer to as target planning in EMDR, which is where we're looking at, again, what is the presenting issue? What is the thing the client wants to see change around? And then what are the past environments, relationships, and experiences that have created and reinforced that? And then I think even, as well, like the processing. I think it's a both and, right? Because like more cognitive based therapies are what we would say are extraceptive, right? Where we're focused on what's happening here. EMDR is very interoceptive, and it's really all about the client focusing more on in here, what's happening inside their body, and paying attention to what's happening internally, which is really where the magic happens in the context of EMDR. So I think really there is the potential and the capacity to integrate just about any approach with EMDR, especially psychodynamic therapy. And for me personally, I integrate a lot of parts work and also somatic work in the context of EMDR.
Okay, awesome. So somatic and work is kind of an area of interest for Mona. I don't know how much of that we put on her versus how much
No, it is. It
Alas,
definitely is.
and Mona's background is positive psychology.
Oh, that's awesome. So I'm speaking your language, Mona.
Yes,
Yeah.
yes, you are.
The other thing that stands out to me there too, and this is just another geeky fact, which I know we're all going to love, but we know that the brain, right, which is the organ in our skull, and the mind, which you could define broadly as like our experience as it's happening, the brain and the mind have a reciprocal relationship, right? So the brain can shape the mind, but the mind can also be used to shape the brain. And here's what really blew my mind, quite literally, is when I learned that the mind is embodied, right? Meaning it doesn't just exist up here in our skull.
Yeah.
It's literally in our bodies. And it is also relational, meaning,
Mm.
now this is the really weird part, it's outside our body in our relationships. So ipso facto, we can use the power of relationship and the power of the body to literally reshape the mind and therefore reshape the brain.
Wow.
That is, I love that so much. But like, it makes me so excited
I
because
know.
I feel like that right there really speaks to the evidence of why therapy works,
Yeah.
right? Why our whole field exists,
Yeah.
right? And so, absolutely.
Yeah. And the hope, right? Because like
Yes.
that's the thing. Like, just like we can uninstall an outdated program on your iPhone and install a new program so your phone can work, we can do the same thing with your brain, right? We can uninstall those outdated programs from your past environments, relationships, and experiences that aren't serving you now. And we can help you install updated programming, which again really leads to significant change in how you see yourself, the world, how you show up, how you behave. And so it's an honor and a blessing to be a part of. But I also just have to give kudos to EMDR for my own journey because I
Mhm.
really don't think I'd be here having my own curriculum, being an international trainer, like just all of the different opportunities that I've gotten have really required me to put myself out there. And
Mhm.
historically, as a perfectionist, that's been something that was pretty challenging for me. And so I just, I'm so grateful for EMDR, not just for how it's changed my career and allowed me to help so many people and also protect myself from burnout,
Mhm.
but
Mhm.
also like how it's allowed me to change myself, right? And to show up more authentically in the world.
Oh, I love that.
That's
Yes.
awesome.
And so, Jacinta, I'm going to come to you for a question, but I just had this one thought while you were just talking about that. We talk about all good therapists need therapy, that sort of thing, right? And this
Amen.
idea of us doing our self work, doing your personal work, so that we
Amen.
can stay healthy. Is there like self EMDRing, like, or is it only in the relationship with the therapist?
Yes, that is a great question. And that is not an uncommon question.
Okay.
Um, so, when it comes to EMDR, there are aspects that you can do self use on. And actually, Francine Shapiro, who's the person who discovered EMDR, she actually has a self help book. You can't see it because my blur's on, but it's called Getting Past Your Past. And so, that is a self help EMDR. So,
There
she
it
has
is.
tools and techniques that you can use personally that are EMDR related. So, I'd recommend that. And the main aspect of EMDR that's self-use is more of those resources that I was talking about earlier, like the peaceful place, the things that are more about nervous system regulation. When we think about the positive trauma resolution aspect of EMDR, Francine really puts a boundary there, right? And she says it is difficult, if not impossible, to do complete self-processing with EMDR. And for me, being an RCT therapist, a relational cultural theory, therapist, I'm a big believer that the relationship is part of the vehicle for change, right? And so I just think, and this is really actually part of my why, like part of why I created the curriculum and part of why I do what I do is because for me, it is such a profound experience to see the healer receive healing. And I think that, kind of just like you were saying, if we're not doing our work, our stuff is kind of subconsciously playing out in therapy with our clients. And so I really think the best clinicians in general have their own therapist. And I also think the best EMDR clinicians have their own EMDR therapist, because it gives
Mm.
you a much deeper respect for what we're asking our clients to do when we're asking them to go there and to process, their experiences.
Awesome. Yeah. Jacinta, did you have questions for Libby?
Um, I have a question, but I'm not really sure it makes sense.
Okay, let's talk it out.
So I have heard EMDR therapists say that they've had clients that come in and the client has suffered traumas, different traumas, but they may come in for one trauma in particular. And when the EMDR is performed, the another trauma is what's unlocked.
Mm.
Why is that? Can they, is there a way to focus on the trauma that they are looking for healing for?
Yes, yes. And I'm so glad you asked this question because this is a big topic of discussion. And again, another reason that I was inspired to develop resilience focused EMDR. Because in EMDR, there are kind of two schools of thought when it comes to how do we start trauma processing with a client. And what I also want to say is that we know part of what makes something traumatic is that our clients lose the ability to have choice. So, when and where we can as therapists, we want to give clients choice.
Yeah.
And yet, right, some of our clients may come in with a sense of urgency to work on a particular traumatic memory. And because of their history, they may not have a window of tolerance that actually would support them in going to that particular memory or
Yeah.
to receiving the amount of bilateral stimulation that would unlock not just one memory, but multiple memories, right? Because that is something that can happen in EMDR. And there are things that we as the clinician can do to influence that. And so that's a big part of the training that we do is teaching clinicians how do you do trauma responsive EMDR so that it can be accessible to a wider variety of clients, right? Because most of us work with complex clients.
Yeah.
And also that we can be conservative because again, it's not necessarily wrong. And this is a school of thought, right? That you start with someone's first or worst trauma, or you just start wherever they feel like they want to begin. But as a trauma responsive therapist, when I heard that frame of logic and thought about my clients, I was like, oh no, there's something in my gut that's just telling me that's not going to be a thing, right? And so we really emphasize the other side of the street, which is that you also have the option to wade your client in the water, right? Like you, and I don't know about you ladies, but when I'm getting into a body of water, I'm going to be dipping my toe in. And if the temperature is right, maybe I'm putting the foot in and now we're going to consider getting in the pool. But if that temperature is off, it's like, nope, right? So I'm a big believer that a compassionate way to approach this kind of work with our clients is to start with something that's more present, future, mild, moderate in nature, so that their first experience with trauma processing, they can feel the benefit of it. They can see how it works for them
Yeah.
without opening Pandora's box, so to speak, which can happen because, again, that is like one of the frames that is kind of out there in EMDR, which is, oh, it can be the best to start with someone's first or worst trauma. So it's about like, how are you picking the target that you begin with that can influence some of that? And then also the amount of bilateral stimulation that you're using. What is that? Because that's a super fancy term. Bilateral stimulation is anything that crosses the midline,
Yeah,
right? So when you're walking, that's bilateral stimulation. In fact, that's what Francine Shapiro was doing when she discovered her eyes were darting back and forth or up and down very rapidly. She was actually walking at the time. Now, she picked up on the eye movements and so started recreating those intentionally. But over time, we realized that tactile EMDR can be very effective as well. We also use tones, effective, but not as effective as the eye movements and the tactile forms of bilateral stimulation. But just
So
as
I'm sorry.
quick
When you
rule
talk
of thumb.
about
Well, just really
bilateral,
quickly. Yeah, I wanted to say the piece about the bilateral is what we know is that in general, when you're doing this rapid tapping, it activates the nervous system, right? So we actually put someone into sympathetic or fight or flight, right? Because we have to do that in order to do the neuroplasticity, right? That we were talking about earlier in that positive trauma resolution. But what we know is that there's a threshold, right? So, like for the first few seconds, like the first 5 seconds of the rapid tapping, it actually has a calming or grounding effect. But after 5 seconds, we start activating. And then the longer we tap, the more activation comes into the client's nervous system and the more access they have to their neural network, right? So we teach the processing spectrum, which helps you, the clinician, to determine, hey, is this a really complex client where we really need to just try to work on one trauma memory at a time? And if that's the case, we will guide you to use shorter uh, bursts of bilateral stimulation, if you will. Whereas a high functioning client, maybe not even diagnosable, but just has some sort of pattern or challenge that they want to work through, we might guide you to do longer sets of bilateral stimulation with someone like that who has the capacity to tolerate whatever memory is going to arise for them, right? Whereas we find with more complex, more symptomatic clients, if you give them too much BLS and they have too much room to go, they kind of end up feeling like Alice falling down the rabbit hole after EMDR. And it's like not in a good way. They're like, oh my God, I started with one thing that was upsetting, and then like five other things that were upsetting came up, and like I don't feel any better. Right. And so that's kind of the art of EMDR that we really try to emphasize in the resilience focused EMDR basic training.
Okay.
Yeah. I have a question about, because obviously Geeky Clinicians as a community is a community for clinicians by clinicians. And I am super geeked up right now. I'm so ready to just like jump into the EMDR class and be like, okay, let's start learning, let's do this. But one of the things that's always kind of gave me pause on making the commitment to EMDR is it felt like, and I'm old, so maybe this is why, but it felt like it's going to take a really long time, right? Like how long and intent, is the training, what kind of level of commitment does one have to make as a clinician? I totally see the value. Like I am like super excited, but I'm also hesitant. Like I'm old. Am I going to be like 75 before I get done? God.
So I believe in full transparency, right? And I think you hit the nail on the head. You have to be open and committed if you really want to develop an EMDR skill set and really become an EMDR therapist. Basic training in and of itself is a commitment. So basic training, according to Andrea, is 50 hours. I do my training in a way that you get your 40 classroom hours out of the way. So we do a Monday through Friday, 8 a.m. to 5:30 p.m. each day. And then you're getting the full story of EMDR. Like in the first half of the week, we focus on nuts and bolts, just basic EMDR. And then in the second half of the week, we really get into the meat and potatoes, right? Like what does it look like to use this with complex clients? The cool thing about the training is that you're actually doing and receiving EMDR throughout the week, right? So the first time you do EMDR, it's not with a client in your office. It's actually with a client who is also a clinician that is there to learn EMDR with you at the training. So that's kind of a cool component of that. And then after the 40 hours, you have 10 hours of consultation that you have to complete within a year from the start date of your basic training. So essentially what that looks like is then as you're using EMDR with your clients, you would schedule to meet with one of my coaches and consultants via Zoom or over the phone. And then you're sharing with them like the cases that you want to use EMDR with or people that you are using EMDR with. And then you're having the opportunity to ask questions like, hey, I got this response to processing. What do I do? Or like, ooh, this resource didn't work. How should I pivot? So it's really kind of great because as you're beginning to apply it, you're not just kind of thrown to the wolves. You actually get, to get the support from experienced EMDR therapists. Now, I will say, basic training, fantastic. You're going to be able to use EMDR with your clients like literally the day after you leave the basic training.
Okay.
Will you feel like an EMDR guru at the end of that 50 hours? No, right? Like that's just the honest truth, right? Because just like any skill set, it has to develop over time, right? Like we know it takes at least 6 months to develop a new neural network. And I know for me, it was certification, which is the thing that comes after basic training, where I really felt like not only was there accountability that helped me to practice, but because of the way that certification consultation differs from basic consultation, like you record audios and you really get into the nitty gritty of fidelity to the model. It was at that point that like EMDR went from something that was a little robotic or mechanical and like I had to plan for like, okay, next week we're processing this target to now it's something that just like flows naturally into the work that I do with my clients. And again, I wouldn't look back. Like now that I'm here, I'm like, man, not only do I wish I'd learned this skill sooner, but there are also parts of me that wonder, like, what was I doing with my clients when I wasn't doing EMDR? And I am not one of those therapists that's like, EMDR is the only way, right? Like, I'm like, there is no territory on healing here. Whatever works for our clients is what we should be doing. But with that being said, I think it's like a both and. If you want to really work with trauma, which in my biased opinion, based on my experience as an EMDR therapist, comes from our past environments, relationships, and experiences, you need to not only have a model that can work with the thinking brain, like our CBTs, our DBTs, the more talk-based therapies, you also need to have a therapy that's going to allow you to work with the downstairs brain and the body, which I really believe is the primary driver of a lot of the stuff that our clients are bringing into therapy and that they want to see change around.
Awesome. Awesome. Mona, did you have a question?
I just agree with what you just stated, because the body definitely keeps the score. We talked about that, right? And it definitely holds on to a lot of our experiences that we have had in our lives. And so I'm with you, Dr. D. I'm like, I want to take the training tomorrow.
Yay!
Yes, yes. So Libby, there's a couple of questions that we generally ask here.
Sure.
We usually ask, on your clinical journey, what has been your biggest challenge as it relates to your growth? And then what have been your biggest wins, your WINSs? So
Ooh,
first with the challenge, what has been the biggest challenge? And
yes.
then some of the wins.
So I feel like the challenge is like a two-parter, right? Because just like logistically, I'm not just a therapist, I'm also an entrepreneur. Like I have my
Mhm.
own private practice, I have the EMD, the brain-based EMDR training company. So I think one of the biggest challenges is that when they're training us to become licensed therapists, they're not training us on the business side of what it means to have a private practice or, to train, have a training company, things of that nature. So a lot of that has come through, self-teaching, consulting with other amazing, experienced clinicians who have had their own experiences as entrepreneurs, coaching, things of that nature. And then I would say the other challenge is again just my own outdated programming, right? Like I tend to be a perfectionist, and so sometimes I can get in my own way. And so that's where like I like to joke that my EMDR therapist is gainfully employed. Like she knows she will be seeing me every other week for that reason, because I want to make sure that I continue to update the programming so that I can show up adaptively and authentically. Because let's get real, life doesn't stop happening just
Yeah.
because we grow up, right? So those are the challenges. The wins, man, I mean, just so many, right? Like, I just feel so blessed and honored to be in a place now where I don't get to add, I get to add and multiply, right?
Mm,
Because as an EMDR therapist, I can only do so much one-to-one therapy. But as an EMDR trainer, I can empower multitudes of therapists to get to go and change more lives with EMDR. So that has felt like a huge win. Um, I think the other piece, and this one was maybe a little begrudgingly. Do you know Micah Miller? She does like human design. You got to
yeah.
do human design with her if you haven't yet, but she kind of like called me in, if you will, and she was like, part of your journey is really for other people to learn, from what you've experienced. And I'm like, wait, did you not get the memo? I'm a perfectionist. Like, I don't share my flaws. Okay, this is not what we're doing. But that for me, I think has been a beautiful thing, is like realizing that, just like my mentor who inspired me to get into training, that I too was born into trauma work. I think I shared with you and everyone at the Clinician Connection. Although I am white passing, I am Wyandotte Native American. And so my own family system has patterns of historical and intergenerational trauma. The Wyandotte Native Americans were actually on the Trail of Tears to Oklahoma, where the reservation exists today. And so I think being able to share my own family story, which keeps my loved ones who have now passed on close to me, but also just allows others to like, I guess be validated in their experience. And that again, it's really this idea that for so long we've wanted to like simplify trauma to just like this one thing, but really it's like there's such a bigger picture, right? When we look at the historical trauma, which are the larger historical events, again, typically happening to marginalized parts of the population, slavery, Holocaust, Trail of Tears, Asian American internment camps,
Mhm.
what's happening right now in the United States, with certain populations, but I think also greater historical trauma that affect the whole society, right? Like
Yeah.
COVID, the Great Depression,
Yep.
natural disasters that affect entire communities, that we're really now understanding that's the thing that gives rise to the intergenerational stuff. And that's the stuff that trickles down through families. And then really contributes, to a lot of the challenges and issues we experience, not only as individuals, but as families and as a society. So that's been a win, because not only do I get to share that story, but I get to share the hope in that I can share things that I found that have worked for me, worked for the people that I've served. And I like to say I'm never going to give you the bad news without also giving you the good news. So that has been a win as well, that we can talk about the hard things, but we can also like talk about how to overcome them.
Yes, yes. And so like I said at the beginning, I had the privilege of attending Libby's training at the Clinician Connection, and just amazing energy and such a deep wealth of knowledge, and just really being able to convey that very complex terms around the brain and neuroscience and all of this stuff in very digestible, relatable ways. So I can't wait for brain-based EMDR and Geeky Clinicians Academy to partner on the Atlanta in-person event that will be in 2026.
We're speaking it into existence, y'all. Yay!
Yes. Mona, Jacinta, any questions before I give the final wrap-up question?
Yeah. I have also heard that it is unadvisable for anyone that does not know EMDR to try to practice EMDR, which makes sense because you're supposed to stay in your lane, stick to what you know.
Yes.
I am wondering, what might an untrained clinician unleash by trying to do EMDR?
Yeah. Well, and it's sad to say, but I have heard cases of people experiencing EMDR with untrained clinicians. And I will say this, anyone who, is a master's level clinician, EMDR is something that you have the capacity to learn, right? And just because of our ethics, we always need to be operating within our scope of practice, right? And so EMDREA, the International Association, says, hey, in order to operate within your scope of practice, realistically, you need about 40 hours of, experience and education on this topic to be able to move forward in a way that's going to help you keep your clients safe. And so I think the risk that you run if you are attempting EMDR and you're not trained is that you could really re-traumatize someone. You could also cause them to decompensate and actually cause their symptoms to get much worse. So those are kind of like the two major risk factors that I see, in addition to just scaring the client off from EMDR and them believing this is something that's unhelpful or can't be useful for me, when in reality, it's a nature of not knowing and understanding how to apply that with that particular client. Because I can count on one hand the number of clients that I haven't been able to use EMDR with since I got trained in 2016. But it really is important to get the training. And if you become an EMDR therapist, like you really practice EMDR, the likelihood is you'll take your basic training and that won't be your last training with EMDR, right? You'll go on to get advanced training, I think, again, which can really help to just make EMDR something that's more accessible, that flows more, that integrates more. And so that's kind of the final thought on that.
Okay.
Great
I have
question.
one more. With the knowledge of bilateral stimulation,
Yep.
might you be able to access the same advantages um, from tapping, maybe through exercise, which is also a lot of times bilateral?
Yeah. So interestingly enough, Francine Shapiro discovered EMDR when she was going for a walk in nature one day, right? So she was going for a walk. She was thinking about something that was upsetting for her. And then she noticed after the walk that she just wasn't feeling the same way. Now, again, she was walking, but she noticed more of the eye movements. And so that's what she intentionally tried to recreate. But, for that reason, absolutely. We know that even 15 to 20 minutes of aerobic exercise is equivalent to a dose of antidepressants, even in adults. So I don't know if it's the exact same like process because again, like Francine was specifically focusing on
She was
something
focusing.
upsetting. But yeah, like if you were focusing on something upsetting and then you went for a run, you'd be using the same mechanisms that I use as an EMDR therapist.
Okay.
Great questions. I can't wait to get all three of you trained. We're going to make it happen.
Yes.
Mona, did you have anything?
Mm-mm.
Okay. All right. All right. So, Libby, our closing question here that we ask all of our guests on the Geeky Clinicians podcast is, what are your best hopes? What are your best hopes for our profession, our field, maybe specifically as it relates to EMDR or for clinical entrepreneurs? But what are your best hopes for the future?
I think my hopes really focus on like hope for healing, and to have professionals who again can come at healing from different directions, whether that's from more cognitive based therapies, which we would say are top down, but also having the capacity to engage more bottom up healing, which is what we've been talking a lot about today with EMDR. To have clinicians who can provide that trauma responsive care and support, not only for themselves, but for each other, right? Because we have a lot of healers that also have wounds. And I'm a big believer that we too deserve the healing that we give so freely to our clients. I think the other hope is for connection, especially in this day and age where we have a lot of illusions of connection, but even just being at the connection conference, getting to hug you, right? Like that was just so wonderful. And I'm just a big believer that when we come together, we really just increase our capacity to contribute to the greater good. So that's also my hope, is for connection and collaboration so that we can continue making an impact and making a difference together.
Awesome. Well, I definitely look forward to lots of that in the future as well. For those people watching, Libby's contact information, her website, Brain-Based EMDR, that information will be in the show notes. And as if you have not already, please subscribe, share, spread the word, and join our mailing list so you can stay in the know, because that event for 2026 is happening.
It's
So
happening.
you want to be the first to know. So join
Yep.
the mailing list so we can go ahead and get you guys connected.
And one last thought there too, Deborah, is that if anyone is interested, we offer virtual and in-person basic trainings about once a month. So they're welcome to check out the website for training description, objectives, itinerary, CE information, all of the above. And then I would just love to extend a discount to all of your listeners. If they are therapists who want to get trained in EMDR, they can use code EMDR 2025, and that will give them a $200 discount off their EMDR basic training.
Thank you so much. That's awesome.
Absolutely.
Excellent. All right. Thank you guys for watching. We'll see you guys next time. Thank you.
Thanks for having me.